Cassandra Musil, and this is my presentation for the overhead squat with a compensation of feet turning out or flattening. This test that I will be looking at today is the overhead squat. This test measures the lower extremity movement patterns of the patient. During this test, we will assess their dynamic flexibility, core strength, balance, and overall neuromuscular control. This is the correct positioning when completing an overhead squat. From the anterior, you should view their feet, ankles, and knees, and while performing this overhead squat, their feet should remain straight and their knees in line with their feet. When looking at it from the lateral view, you should be assessing their LPHC, shoulders, and cervical complex. Their tibia should remain in line with their torso as they complete this exercise. When looking at it from the posterior view, you should assess their foot, ankle complex, and LPHC. Their foot and ankle should have a slight pronation and an arch should be visible. Their feet should remain straight with their heels in contact with the ground, and their lumbopelvic hip complex should not shift to one side. These are two possible compensations for an overhead squat: feet turning out or externally rotating, and feet flattening or everting. These pictures demonstrate what would be shown if somebody were to show these compensations. Some overactive and underactive muscles for these compensations include, for the turnout, the overactive muscles would be the soleus, lateral gastrocnemius, biceps femoris, and the tensor fasciae latae. And for flattening, the overactive muscles would be the peneural complex, lateral gastrocnemius, biceps femoris, and tensor fasciae latae. The underactive muscles for turning out would be the medial gastrocnemius, medial hamstring complex, gluteus medius and maximus, the brachius, popliteus, sartorius, and the anterior tibialis, posterior tibialis, medial gastrocnemius, and the gluteus medius would be the underactive muscles for the flattening technique. Potential causes would be plantar fasciitis, Achilles tendinopathy, medial tibial stressism, also known as shin splints, and ankle sprains, and patellar tendinopathy, also known as jumper's knee. The first phase of the corrective exercise continuum is the inhibitory phase. One of these techniques include the self-myofascial release. This is focusing on inhibiting the overactive muscles, such as the tensor fasciae latae, the biceps femoris. This should be done daily, and when performing this exercise, you should hold the tender spots for 30 to 90 seconds, 30 if it is at maximal pain, and 90 if it is at minimal pain. This top image shows how somebody should perform self-myofascial release if they are focusing on the tensor fasciae latae, and the bottom one shows how they would foam roll or self-myofascial release for the biceps femoris. The second phase of the corrective exercise continuum is the lengthening phase. One lengthening technique would be static stretching, which is focusing on lengthening the overactive muscles, such as the biceps femoris or the lateral gastrocnemius. This should also be performed daily unless told otherwise by your practitioner. You should hold this for 20 to 30 seconds. Unless you are over the age of 65, then you can hold it for 60 seconds. This first one, with being on the ground, is how you would static stretch for the biceps femoris, and the one using the wall is for the lateral gastrocnemius. The third phase of the corrective exercise continuum is the activation phase, and this focuses on strengthening and activating the underactive muscles, such as the medial gastrocnemius or the gluteus medius. This should be performed 3 to 5 days of the week. Every time, you should perform 1 to 2 sets and have 10 to 15 repetitions. You should have a 2-second isometric hold at the end range and 4 seconds for eccentric. These videos will go over the correct technique when performing these exercises. For this exercise, you're going to have a pulling machine. That first video went over the isolated strengthening technique for gluteus medius, and the second one is going over the isolated strengthening technique for the medial gastrocnemius. The final phase of the corrective exercise continuum is the integration phase, which is the integrated dynamic movement exercises. This phase is to reteach functional movement for all the muscles used during the overhead squat. This should be done in a progression, starting easier than working their way up. For example, for this certain exercise, you would start with a lower amount of weight, then work your way up to having heavier amounts of weight. This should be performed 3 to 5 days out of the week, every time doing 1 to 4 sets with 10 to 15 repetitions. When performing these exercises, you should have slow and controlled movements. This video goes over the correct technique when performing this exercise.